Hello. Um, my name is, let me introduce my co-presenter here, ladies and gentlemen. I am honored to introduce Vickie Mudra, MPH, PCC, a powerhouse educator, consultant, coach, founder and CEO of the Institute for Deliberate Practice. For over 30 years, she has guided mission-driven organizations using her credentials in healthcare administration, public health, Lean Six Sigma, I could go on, to set herself apart as an unwavering, genuine heart for strengthening public health professionals. And she does not just lead with her mind and her credentials, she leads with her conviction. So that's Vickie Mudra.
We, we decided to change it up and introduce each other today instead of introducing ourselves. So it's my pleasure to introduce Ashley Morgan Jackson, a human-centered HR leader who's passionate about empowering people and organizations to thrive, bringing a balance of strategic vision and practical execution to every initiative that she takes on, helping leaders build resilient workforces. That's what we have in common. Prepared for today's challenges and tomorrow's opportunities. So,
All right, so I just want to say that I am a member of the CDC's FIG grant. I am the Workforce Development Director for Pima County, and the work that we're going to discuss was supported by FIG, so definitely want to share that information ahead of time. So why are we here?
well, over the past 18 months, IDP, my company, and Pima County, Ashley and her team, partnered with one clear aim. Embed well-being into the daily operations of a major public health department, not make it just a side initiative. This was not a vendor-client relationship. We started out with a partnership that was really rooted in listening, co-designing, and responding to the real workforce needs. Yeah.
And so responding to those needs required that we were proactive in our leadership, especially in my department. So we're going to go back and forth. I'm going to focus a lot on what we did in Pima County and some of those responses, and how that connects to the work that she was doing. So again, we were learning how to teach the difference between just providing you an intervention for one small change that you needed to make when what we wanted was an overall culture shift in our department. And so we did that using identifying three practical tools, which were the pillars of our change, kind of the framework that we used, which were trust, tools, and time.
Mm-hmm. Yeah. So those were our grounding pillars. So, and we wanted to make them simple enough to remember. So when you keep things simple, people will use it. So. Yeah.
And it's hard to forget. So one thing that brought us together was our similarity in frameworks. So when I first started as workforce director, I came up with a framework that would help me determine how I would spend the next 4 years on the grant working with the department. I wanted to make sure that leadership created healthy connections, not just between leaders and staff, but across the community, across the divisions in the department. I wanted to make sure we actively promoted wellness. We can't take care of our community if we can't take care of ourselves. It's just that simple. We wanted to make sure that we recognize contribution. We're always talking about innovating at the speed of change, but how often do we take the time to recognize people for the things that they're doing? So we wanted to make sure that recognition was something that was recognized in our department. We wanted to empower our employees. There's so many things that go on in a county. There's so many things, especially when you're working with the government, that you need to know. You need to know how you can protect yourself. You need to know how you can protect your staff. You need to know what you can do. Can I take this 15-minute break outside? Small things. So we wanted to make sure we empowered employees by educating them. And then we wanted to make sure that while I am a grant-funded employee, the things that I put in place, I wanted them to be sustainable beyond the grant. I just don't want to give you a Band-Aid and then the grant's over, so now it's gone, you know? So that was my cares. And then I met Vickie, and I found out about her cares.
So one of the first really fun things, we like to have fun together if you didn't already know. One of the first things that we discovered is we both had care models. So mine is a trademark model, and it's something I use with all of my clients and all my strategic partners. It's really simple. It's built on 4 pillars: connection, awareness, resilience, and empowerment. There are 10 intentional steps underneath. We're not going to talk about those today. It is a powerful process. In the work that I do, I like to remind people that leadership really has 4 lenses. And I love what we've been talking about here today, starting with leading self. We are all the COOs of our lives, and so that is number 1. We are the leaders of ourselves. Then some of us may lead others, either formally or informally. We all lead some sort of work, and we all can lead for vision. We all lead for the future. And the goal is to help our leaders, help all of our staff be happy, healthy, mission ready. And it's less about adding more programs and really about what we found was creating this unifying language, really grounded in care. So, so what we saw is we had different acronyms for our care, but we had the same heartbeat. Oh yeah, I'm up first on this one. Yep. So now we're going to talk a little bit about our success stories. So in the areas of resilience, this was really, I'm a workplace resilience certified coach. It's the heart of what I do. And what was really fun is we saw individual resilience. We can measure resilience. I have tools that help us measure it. And we were able to look at individual resilience, which then translates into team and organizational resilience. So I provided a mission-driven resilience workshop, a half-day workshop. We used the Predictive Resilience Index that comes out of Australia. And then we started having, we had this trajectory and this momentum, and we started having requests for resilience first aid, high adversity resilience training. So those are also programs that we were kind of preparing for. Essential to this partnership really was that middle part. The way that we set the stage for our communication and the collaboration and the coordination. It was a unified structure. We had standardized programming, but there was enough opportunity where we could build in nuances for each of the divisions. So whatever their unique strategic goals were, their unique challenges, we could at the division level build alignment without losing the individuality. And then finally, because we had such great traction, we really were starting to make changes in culture and in the strategy through the division level workshops. So we had things like Intro to a Deliberate Culture or Cultivating a Deliberate Culture, where leaders and staff could come together, they defined their collective purpose and would walk out with purpose statements for their divisions. They defined their team values, culture enablers. And then what we would do is we'd look at the work that they were tasked with, and we would strategically bring that together with their unique strategic plans so that it was tied to the everyday work that they were supposed to do.
All right, and so and I think all of her examples were PCHD staff and leaders. And so I'm going to actually go backwards because focus, a lot of those high adversity resilience trainings and those mission-driven resilience trainings, they were a part of what we call in Pima County as focus days. That's public health opportunities for continuous upskilling. It was our leaders' intention to protect time for professional development. A lot of burnout and a lot of burnout, frankly, a lot of stress leads to always dealing with what you're dealing with, what's in front of you. So the current fire, I'm always dealing with what's in front of me. Now I'm forgetting that I have a whole career ahead of me. I need to be able to devote some time to myself to what if I want to go into psychology? What if I want to be a nurse? What if I want to know what epidemiologists do? So we devote 8 hours a month to our staff. That's protected, and it's for their professional development. It could be something on their individual development plan. It could be something that they pinpointed and want to discuss with their supervisor. But on First Thursdays, we kind of host the day. So we'll have a staff meeting, and then we'll have workshops. I've hosted Vickie. We have other opportunities for trauma-informed care, for mind and body wellness. We teach mindfulness. I've had people come out and do that. So we host those on focus days. So the staff has a plethora of options to take part in on those days. Coming back, Big Shots was our monthly recognition program. That picture was taken recently. This has only been going on for about a year. And so those are not all of the big shots, but that's majority of the people who have been recognized by either their division leaders, another division in the department, or another coworker of theirs as a big shot for a specific reason. We recognize them monthly, they get certificates, and they get big shout outs. And then our last direct connection between leadership and staff is the Walk with the Director initiative. And that's beautiful because it encompasses two things. It keeps people physically healthy because our director, if you don't know Terry Cullen, she is very much so into physical health and wellness. She likes to walk, she likes to hike, and so making her comfortable as a leader to talk to her staff by doing something that she already likes to do, and then keeping the staff healthy was the best partnership of things for us to do. And so of course we keep it accessible. We do have like other events called Coffee and Catch Up or just in office hours where she's not necessarily walking. She's just sitting down and provides her space for casual conversation and questions with staff across our health department. And so those are some of the things that we were doing that were kind of instrumental to this culture change that Vickie became a part of with her care model. So again, back to our pillars, trust, tools, and time. I believe that in order for us to make any cultural changes, we have to start off by establishing trust, right? And so we kind of leveraged my role as the Workforce Development Director and our FIG funding to kind of get some small wins. And then once we were able to get, and I mean really small wins, like the staff wanted mirrors in the hallway because we kept bumping into each other. Imagine having your outreach chart and somebody's walking up the hallway and you don't see them and now y'all are crashing in the hallway. It was a big deal to them. So we got mirrors put up. They wanted filtered water fountains in their workspaces. We got that done. So those small wins allowed them to trust me as a new person to say, okay, what else you got? Let me see if you're gonna actually do what you say. So those are some of the small wins. And then time, that focused time, that protected time, not just for our staff, but for our leaders. I'm gonna actually segue into tools and say that Vickie was a tool for me because I am one workforce director. You know, I don't have the ability to be across our department and talk to our leaders. So I was able to provide Vickie as a resource and say, okay, identify your problems. Let's talk about what you need. Let's identify her solutions and see if there's something in her repertoire that can help you out with what you need. And then I've also added some other tools. We have an informal program called Partners in Pathways, which allows staff to seek out leaders who volunteered their time to talk to them about working in public health, about any of the struggles, especially as we go through some of the federal changes when people just need a safe space. We've done that. And then we also institute gratitude emails. I say thank you to them every Friday in a special email that is just literally to say thank you for everything that you've done. Maybe I provide some resources, maybe I alert them to some training, but it's about encouraging a spirit of gratitude among people who rarely get thanked. And so that led me, of course, into the IDP strategic partnership, or kind of facilitated that, because as of now, 30% of our staff is mission-driven resilience trained, and they are asking me for resilience first aid training and high adversity resilience training. They're asking me, how can I get Vickie back in the door to do that? So my goal is to get us to 80% of the entire department trained in just resilience and start there. There it is. There we go.
So yeah, our relationship began when someone, I think it was 2 years ago, from Pima County attended a NACHO presentation that I was doing with Maricopa County about the resilience work. And so we were sharing the results of the collaborative work around workplace resilience. And so that trust came in kind of like a proof of concept. And so that kind of got us started off on the right foot. And then we continued to build. And as Ashley said, it was really by allowing and encouraging these one-on-one conversations and allowing me to build relationships with these division leaders, to establish that trust in a safe individual space and listen to them, meeting them where they were, because not every division is experiencing the same challenges and they're not looking for the same thing. It depends on tenure of leadership, right? There's so many variables about the performance and satisfaction of a team. And so, and then we brought in a wide range of tools. We brought in frameworks like the deliberate care model. I mentioned the CReC, and then tailored workshops around resilience and culture and emotional intelligence, and communicating with care was a fun one. And then the protected time that Ashley mentioned was key. It really paved the way for leaders to shift their mindset and carve out. It became easier because they kind of had this permission to make this a priority. And so then they started carving out time, or they would invite me to their team meetings and we would do something focused for them. And this overall just investment in workplace well-being, like that's what you started to see and feel, and it was this language, and it was just the way things were moving. Again, we built structured leadership sessions, always keeping the culture visible, and again, prioritizing long-term results. Just like Ashley said, we want to make sure that what we're doing is sustainable so that, you know, when I'm gone, these results can continue and this workplace can still flourish. So yeah, that's it.
All right, highlights and lessons learned.
Okay, so I'm going to cover the highlights. One of the biggest highlights I really think was that unifying care language. These aren't just models. It really came through in the efforts that everybody was making, that these people are cared for. And that has a visceral change in a workplace. When they believe it, when they trust that they are cared for, things shift. And it proved that well-being doesn't need a single definition to take root, right? And so we could kind of blend. Again, the 30% staff trained. There is a desire to be a designated certified resilience workplace, and so that's something that they kind of put on their goals, so we'll see if we can get there. And here's the thing about that, that's scale. That's not just pockets of resilience. That's when you're really looking at scaling resilience efforts. And then I already mentioned the division-specific workshops that were tied to their strategy, and they would have me come in and co-facilitate their strategic planning. So that's the level of trust and vision that we were able to accomplish together.
And then lessons. So first lesson was small wins build trust and momentum. You cannot think you're going to just jump headfirst into a change and it's going to be well received. I don't know if anybody's familiar with change management, but my goodness. So you want to start off with the small win so that they learn to trust you. Lesson 2 would be standardizing core offerings, but then tailoring them to divisions. So we work in a really creative space, I'll say that, where you have to make sure that the offerings that we're choosing are standardized, right? We're not asking her to come in and reinvent a whole wheel for us. We're asking her to come in and assess our needs and then make sure that the offerings she provides may not be for your division what they are for my division, and that's okay. But there are still standardized offerings that we need that address what we need. And then protected time. If you guys don't have anything like focus set up for your departments or your divisions, they don't understand that they have permission to work on their careers outside of what's currently on their plate. That's a tool that's just invaluable. It's actually a retention strategy. So recommendations for success: protect time. I don't know how many times I'm going to say that, but I'll say it. That's the hill. Please protect time. Carve out dedicated hours for resilience and culture work. You know.
Yep. And well-being, you know, I think that's the beauty of this event. Well-being shouldn't be an afterthought. It needs to be a line item in the budget. It needs to be something that people see it matters, and where money goes, then that's what matters.
Empowering leaders. I'm not a gatekeeper. I don't have the capacity to do all the work for all 8 of our divisions. So provide direct access to the resources. That's why I am of value, not because I have all the answers, because I am a connection to the answer. So that's empowering your leaders.
And anchoring in why. Culture change only sticks if leaders connect it back to the mission. Otherwise, it becomes flavor of the month. And we see that with lots of different well-meaning intentions. Protecting our people protects our missions.
And invest in coaching. Coaching isn't mentoring, it isn't peer support, but is an important and invaluable step. If you think of your group of people as players, you need good coaches. They have a shooting coach, they have a guarding coach. I'm thinking about sports, I'm a sports girl. But you need good coaches in your space to make sure your players stay in top performing shape. And then that is it for us. Our information is up here. If you have any questions, please feel free to reach out to us directly here or when you get the slides after. And thank you so much for having us.